traditionally, most of our beds have been within hospital settings, but increasingly we're recognising that there are alternatives to hospital settings. So we're looking at providing a range of rehabilitation services based in beds in our community hospitals, but we're also looking at other alternatives such as beds based in care home settings, where we could also provide assessment and rehabilitation services. So specifically, what we do know is that there is an ageing population, and that particularly in Fife, we will have a far higher percentage of older people in our population. And with ageing, unfortunately, for some people, comes a loss of function and the need for input from rehabilitation services. So what we do need to do now is to just revisit what our services are and what services are needed to continue to be able to provide high quality care and assessment services for older people looking into the future. So thinking about alternative beds, we have mentioned care home settings as a potential place to have these beds, but they would be a totally different type of facility within a care home setting. So they would be a facility where we would have input from nursing staff, but also input from visiting multidisciplinary team members. That might be occupational therapists or physiotherapists, podiatrists, speech and language therapists. But also we want to be able to ensure that all patients have assessment of any medical or pharmacy needs. So we might have visiting pharmacists, we might have visiting GPs, and we are looking at developing a model of a community geriatrician where a consultant physician geriatrician is also available for linking into these new types of facilities. So I think it's a different way of working, it's a different model, and it's providing an alternative to a hospital-based multidisciplinary assessment setting for patients who may not need to be in hospital but also can't quite manage at home. I think the benefit for patients in that setting is that it is more homely, and it is generally closer to the type of setting that patients have in their own homes. So we know that older people consistently tell us they want to be able to live at home and stay at home for as long as possible. Now, unfortunately, in hospitals, the way that we work is not always conducive to older people maintaining their function. So patients tend to have to get up at the same time in the morning. They tend to get given their cups of tea when it's our turn and time to do the tea rounds. They often are given help to get up and get dressed in the morning where they may not need it. And I think a more homely setting in alternative facilities gives us more scope to encourage patients to be able to make their own cups of tea when they want to have their cup of tea, to be more independent and to make that transition between being in hospital to being back at home again. I think seeing and treating and helping patients in the right care setting allows them to come alongside patients in that rehabilitation journey. And to be honest, there's nothing more rewarding than seeing somebody get better, improve their functional independence and get away home. And that is very rewarding for staff and is as encouraging for staff as it is for patients themselves. So what we want to do is to expand the work that we've already done in working with bed-based options in a variety of different settings. So we already have several units in Fife called STAR units, STAR standing for short-term assessment and rehabilitation. So these are units where we are continuing to provide the same sort of processes of assessing what the needs are and then providing rehabilitation from a whole range of multidisciplinary team members, from physiotherapists, occupational therapists, as we've said before, but just in a different way, in an area where patients can be a little bit more independent, and it's often a step for them between hospital and home. But the other thing that we want to be able to do is to provide an alternative step up. So for GPs, for example, or hospital at home in the community, at the moment there's often no alternative when somebody's not able to be managed at home to coming straight into an acute hospital. And we want to be able to develop these short-term assessment centres to be able to take patients direct from the community as well. So I think I would say that we're not really suggesting anything that's totally new or totally different. I think we're looking at developing what we know works and that we've already tried, and doing more of that and doing it better. I think my hopes for the future are, I guess as a consultant geriatrician, I have always been passionate that age is not important. So yes, as we get older, we are more likely to develop illnesses, and we are more likely to have such things as falls, but that is not inevitable as we age. There are a lot of people who age healthily. So one of the things I would hope to see is that we have an increased focus on healthy aging, and I think that is being developed, and I think that's really important. For those whose aging is less healthy for a whole variety of different reasons, I am certain that we need to be able to provide a range of opportunities of assessment. Those opportunities need to be easily accessed. They need to be accessed quickly when patients and doctors need to be able to refer into those. They need to be accessed simply and seamlessly, and there's a lot of work being done in the community health and wellbeing hubs to draw these services seamlessly together.